Hello, everyone, and welcome to Fearlessly Authentic. I'm your host, Jody Harrison Bauer, and it is such a pleasure to have you join me today. We have a wonderful show set up for you, and I can't wait to share all of this information because if you are a first-time listener, this is a show where we educate you, empower you with all of that knowledge, entertain you a little bit, and inspire you to live your most fearlessly authentic life because in my humble opinion, what the heck are we doing here if we're not doing that? Easier said than done at times, right? We all struggle a little bit, but that's why I'm here because I get it. I've gone through it and I want to help you be your most authentic self. So please remember to rate, review, and subscribe. You can find me on all streaming platforms. I don't know why I just said streaming platforms. That's really weird. On the internet, now I sound really old, at Jody Harrison Bauer. And you can also watch this on YouTube at Jody Harrison Bauer as well. Today, I am joined by Dr. Elena Zinkoff. Thank you so much for joining us today.
Thank you so much for having me on.
Yeah, Elena was with us back in August, which seems like such a long time ago. And since that show where we talked about menopause, hormones, and so on, I continue to talk about it. Obviously, that's what you do also. And I get so many questions and I'm always like tagging you, like ask her, ask her, ask her, because I am not an expert. I know what I know, but I'm not an expert. So I'm just going to do a quick intro so everybody knows who you are. Dr. Elena is on a mission to empower women to be their best health advocates, and she is helping women break through the common myths that are taught about hormones and women's health. She is an award-winning naturopathic medical doctor specializing in endocrinology and with over 20 years of nutrition and exercise science. Her focus is on helping women from all stages of life, and especially women in perimenopause, to get out of the conventional way of thinking about hormones and to provide much-needed answers to the most common hormone-related symptoms. Like many women, she struggled with PCOS, poor gut health, and infertility, and she shares the hidden truths in medicine about hormones and women's health. And it is so great to have somebody like you who has gone through these things yourself and struggled. And they always say that it's our struggles that bring us our strength. And that is usually turns out to be our purpose and our mission, right?
Most definitely. Yeah,
Yeah. So is that the reason you decided to practice specifically in hormone health endocrinology because of the issues that you struggled with?
absolutely. It was a blessing in disguise. I wish I had someone like myself when I was a teenager. And I
Right.
frequently share that my mom was an MD and I was prescribed birth control. I was prescribed anti-anxiety medications, antidepressants, and even she as a medical doctor told me when I was considering going into medical school or medical field, she said, go study endocrinology because we don't really have good answers for women.
No.
And I was an anxious wreck when I was a teenager. I mean, my poor mother didn't know what to do with me. I didn't know what was going on with my mother because
Right.
she
When
was
she's
going through perimenopause at that
right.
time. And I remember when I went into medical school, I struggled with acne and I struggled with bloating, poor gut health. And it was really interesting to me because I grew up as a competitive athlete. I played some professional tennis. I had access to nutritionists, coaches,
Right.
psychologists. And when I stepped away from that field, everything sort of fell apart. I didn't know really how to eat because I was in that phase when I was a teenager. And in my early 20s, as I stepped away from that, everything sort of fell apart. It's like, how do I work out? How do I eat? Now I'm feeling bloated. I have more water retention. I'm feeling more anxious than ever before. And I think just with the amount of training that I was doing, the endorphins got me through a lot of the things that I was experiencing. But once those endorphins weren't as high, it quickly became apparent that, hey, there's a really big problem here. And I frequently mention this, that it took me to get through medical school to really understand what's going on with my hormones, because I wanted to get rid of my acne. I did not want to experience social anxiety. I didn't know where that anxiety was coming from. Here I am. Okay, now I'm getting my diet back on track. Now I feel like my gut health is on point. Why am I still breaking out? Why am I still struggling with PCOS like symptoms? And fast forward, when my husband and I were trying to conceive, it's heartbreaking, like it is for a lot of women, when everyone around you is getting pregnant and you're the one that is technically doing all the right things, but
Right.
for some reason nothing is happening. So it's really my life experience, even with my own hormone imbalances and just years of a lot of my own symptoms being normalized, led me to really speak loudly on this topic. And I was able to help myself, and now I'm on a mission to help all the other women.
I think so many women who are in their 20s, because while you were in medical school, I assume you were in your 20s and early
Uh-huh.
30s, right?
Yeah.
So you would think that by the time you're in your 20s, you're not having breakouts, you're way past, you're 10 years past the acne stage.
Yeah.
And I don't think back then, and you're only in what, your late 30s, right? Mid to late 30s now, but
39.
even 39. Okay. So back 10 years ago, women really weren't talking about this. As you mentioned, doctors want to put you on, back when I was going through perimenopause, they suggested Prozac for me. So
They
that
still do.
was, they do?
Well, I mean, they still do. It's really common, and it's really fascinating to me to think about all the medical advancements, all the research that we have
Right.
about hormone replacement. As an example, why am I still seeing, for example, and many of my colleagues, women in perimenopause and postmenopause coming in with symptoms, let's say mood disorders or different mood fluctuations, hyperlipidemia, insulin resistance, you name it. And women are still getting prescribed antidepressants, anti-anxiety medications,
I see it all the time.
cholesterol medications. It's the same. The way that we're managing many of the symptoms and chronic conditions that are actually related to hormone imbalances is almost the same.
It's archaic, right?
Very archaic.
Yeah. And even when I speak, and I'm 63 and very postmenopause, and I've been on bioidentical hormones for 3 years now, and I look at women who are going through menopause or are perimenopausal, and they're getting the symptoms, and they don't understand why they're gaining weight, but they're eating the same and they're exercising the same, but are they really? And that's what I have to ask them. Are you really? Because yes, your hormones play a part, but now that you're going through menopause or you're perimenopausal, which means you're starting to feel the symptoms, now you have to tighten up your diet even more. Now you might have to exercise just a little bit more, because what they don't realize is that they actually aren't as active as they were in their early 30s, because they're in their late 30s, mid 40s. They're like, oh, yeah, I'm still working out as much as I used to. You're probably not. And it's
Yeah.
funny, when you were talking about being a competitive athlete, when I was competing in fitness shows, I was going through menopause at the time. And I had all these 21, 22-year-olds saying, I want to be like you when I get older. And now I see them all 39 and 40. And now they're talking about gaining weight and all of that stuff. And I'm like, yeah, you know what? I was on the stage, not on the same stage with you, but on the stage with the 45 and older. But we were all going through menopause at the time, having hot flashes, night sweats, mood swings. It was crazy, dealing with teenage kids. It was crazy. And still then, right, I haven't seen, why are women still complaining about those things, and why are doctors still giving them antidepressants? It blows my mind. And women are scared to try something new. We have
Mm,
to change that mindset. And that's why I love what you're doing. So
yeah.
can we start with what happens if you were to explain to the audience right now? Would you start with explaining what perimenopause is, or prior to that?
Here's what I would say, because there's so many different ways that we can go with this.
Right.
Number one is, when we think about a woman going into perimenopause or through perimenopause, for every woman, it's different. For some women, it could be a few months. It can happen pretty quickly. for example, a woman can go through a really stressful event, could be a divorce, could be stress at work, something happening with a family, emergency, and they can go through perimenopause very quickly. And then menopause only lasts 1 day. So when we're talking about women going through menopause, it only happens for 1 day because menopause marks essentially your 1 year anniversary from you not having a menstrual cycle. And then the next day you're in postmenopause. So all of that.
I love that you just explained that because I remember it was October 2009, right
Amazing.
before I turned 50, that I stopped getting my last period. That was the last time I got my period.
And that is so great that you know that and that you remember that, because there are two things that women should know. Number one is, when did your mother go into menopause? And hopefully your
Real,
mother remembers.
really early, like 33.
Wow.
I know. I was
Wow.
scared.
Yeah, so you did a great job. Maybe you're probably doing a lot, especially maybe with your competitive background, right? But you were
Probably.
probably doing things from a diet lifestyle perspective that were helping you keep your hormones in a certain balance or level that prevented menopause from happening, or
I think so.
prevented you from going into postmenopause or perimenopause
Right. Right.
prematurely. But women can experience symptoms of perimenopause as early as in their 30s. And for some women, it can last 15 years. So here they are, 15 years of slowly starting to experience a little bit of irritability, some brain fog. Where are my keys? Where's my cell phone? Okay, I'm feeling a bit more anxious. Every year, the libido starts to decline. It's sort of, for some women, it can be really slow.
Hmm.
For some women, it can happen much faster. But the point is that if you're in your 30s and you're starting to notice these subtle changes, whether it's in your memory, gut health, so maybe slower bowel movements as an example, potentially it's starting to be harder to lose weight or maintain optimal muscle mass. Those are all really important things to pay attention to, because hormones really affect not just our reproductive health, not just our menstrual cycle, and that's a big one. I should have just started with that. If you're starting to notice fluctuations in your menstrual cycle, maybe you're starting to become more irregular, or now your period, instead of being 28 days, it shows up every 40 days, every 24 days. Maybe now they're a lot heavier, or you're experiencing cramps, or you feel like you're going through puberty again, right? That
Right.
happens in our 30s or in our 40s. It's like, didn't we go through that like 20 years ago? Why is this happening again?
I know.
So it's really important to start paying attention to those symptoms. And the other really important point is that it's not just estrogen and progesterone, because that's what a lot of people will focus on.
Yeah.
Well, right, estrogen and progesterone will decline as we get older. And what happens is that there's usually an imbalance between the two. They may look normal on the labs, but if you look at the ratio, let's say between progesterone to estrogen, that ratio is off and it's much lower than it should be.
Can you explain to women listening
Yeah.
what estrogen does, what
Yeah.
progesterone does, and how they affect our bodies?
Yeah, absolutely. So real quick, because there are so many other hormonal fluctuations that happen, again, not just estrogen and progesterone, but we have receptors, and receptors, it's their receptors are like the place where your body gets the mail. Effectively, the mail is the hormones, and then they attach to their receptors. That's like the inbox, and then your cells then they get to work. So, but we have all these receptors for hormones all over our body. They line our uterus, our heart, our brain. We have receptors for bones. So estrogen is extremely important. It has systemic benefits for brain health. It's really important for brain density, cardiovascular health. So the American Heart Association has tons of research about the importance of estradiol on reducing atherosclerosis and plaque formation. That benefits on how well our heart functions, preventing blood pressure, as an example, high blood pressure.
Right.
not preventing blood pressure,
But
elevated blood.
but right. And I
Yeah.
don't think a lot of women think about that plaque formation, which will cause heart disease, which will cause a heart attack or a
Yeah.
stroke, right?
Well, and if I go even a little bit further, estrogen, and part of it has to do with also estrogen helping regulate insulin secretion, production, glucose uptake. So, and lipid metabolism. So what happens is that as our estrogen levels decline, you can almost see this direct relationship on the lipid levels. So as estrogen starts to decline, it's an inverse relationship, I should say. As estrogen levels start to decline, we see a rise in cholesterol. And so a lot of women, even they're really healthy, there is a genetic predisposition, because it's not just about cholesterol, right? There's,
Right.
some people can have really high cholesterol, but their ApoE gene is fabulous, and they're less likely to be predisposed to having atherosclerosis, right, or cardiovascular disease.
And I remember that after I had both of my daughters, my cholesterol level went up. It
Yeah,
spiked for like 3 months after I had them, and the doctor said that was normal, and it came down.
right.
But it
Yeah,
was, yeah. So it's like all different things could affect it, but there could be genetics, right? That plays a
yeah,
part in cholesterol too.
yeah. And so estrogen is really important from lipid control, cardiovascular health, brain health, and low estrogen levels are linked to Alzheimer's like symptoms. So dementia, for example, memory
Makes sense.
loss. So estrogen is extremely important for bone health. It's also very important for ligament and tendon health, muscle strength. Because we're as strong as our ligaments and tendons. If those fly out, right, or break or get torn, like we it sets us back for a while.
It does.
So yeah, and then progesterone is extremely important for brain health as well. So a lot of women who struggle with mood disorders like depression or anxiety, because of the role that progesterone plays in our brain, especially at how it's metabolized, stimulate the GABA receptors.
Mhm.
Progesterone is extremely important for overall mental wellness in women. And so why do we need to prescribe anxiety medication? Why do we need to prescribe antidepressants? There's a time and a place for those medications, especially when someone is going through trauma or dealing with past trauma, or basically the point being is use those things short term if necessary, if needed, right? Because sometimes, we don't have control over certain circumstances that happen in our life. But when we're thinking about long term, if we just simply even correct basic hormone imbalances, such as declining progesterone levels in women, especially in perimenopause, women are not going to need anxiety medications or
Right.
antidepressant medications.
So let me ask you a question. We have a teenager, we have a college student, we have somebody in their 20s, and they are anxious. Both of my daughters are millennials. So that for me, that your whole generation, everybody gets anxious. It's like we've all been able to, everybody's been able to say they're anxious.
Yeah.
And I'm not taking anything away from that, because I understand that anxiety is a real thing. But would you suggest that if there is a girl, a young woman struggling and feels very anxious, would you suggest that she gets her hormones checked first before she goes on anything?
Yeah. Frequently, whenever I do different talks, everyone wants a solution. Like, what do I take? What do I
Right.
do? And I've shifted not necessarily away from take this, do this, don't do this. But number one thing everyone needs to do is get a hormone baseline, because I can sit here and tell you what vitamins to take. And certainly there's just like there are baseline supplements that we should be on. But when it comes to hormones, before you take any herb that says this is hormone balancing, you really want to know, what does your hormone landscape look like? Because herbs work, and they can either make things worse or make things better or not do anything at all. But you won't know unless you test. And
And you
even,
can't throw all these things in your body at once and then try to figure out what is what. You have to start with a baseline.
yeah, yeah. And going back to, I mentioned that there can be this imbalance in the ratio between progesterone and estrogen. let's take a 20-year-old, for example, and we get a hormone baseline, and we see that the estrogen and progesterone is in range. So this is what an average physician will do. Oh, well, your hormones are in range. You have nothing to worry about. It's not your hormones.
Mhm.
But what they fail to take into consideration that that's just a standard range, right? That is for the average sick person. So what conventional medicine is technically good at, but even in this case, they're starting to suffer, is the conventional medicine will look at, are you falling off on the low end or are you way too high on the other end? And then they may potentially raise a red flag. And the reason why I'm saying potentially is because I honestly think just a lot of healthcare providers in conventional medicine have become so lazy. It's unbelievable the amount of patients that I see come to my practice where I even look at their basic labs and they're outside of the normal range and no one is doing anything about it. I'm like, it is, at this point, it's just obvious that there's something wrong and they're still not doing anything about it. So we have to be, besides getting a baseline, we have to work with physicians or other healthcare providers that will actually do something and will be proactive and not wait until you're too low or too high to do something about it. So going back to our 20-year-old, the estrogen and progesterone levels, okay, they're in the range. Are they optimal is a whole different conversation because estrogen could be a bit on the higher end, progesterone could be a little bit on the lower end. And this is where we need to just do even a basic calculation. And this is where women can even just find a progesterone to estrogen calculator online. It's available online. So if you have your estrogen and progesterone levels, you can simply plug in the numbers and see what your ratio is. And if it's below 100, then you've got a bit of estrogen dominance because the progesterone to estrogen ratio should be between 100 to 400. Some women, it can be as high as 400 to 1,000. It just really depends on the woman.
What if she is estrogen dominant? How would that make her feel?
Yes. So a woman who is estrogen dominant will feel more anxious. She will have, she can have acne. So symptoms of acne, hair loss, irritability. And we have to think about what can potentially cause that estrogen dominant symptoms. A lot of women will have some sort of underlying gut issues. So
like constipation,
which it increases the likelihood of estrogens recirculating and estrogen metabolites. So you're no longer excreting the estrogen breakdown products, and that can make you more estrogen dominant. So those are some of the common estrogen dominant symptoms. Okay. And from a menstrual cycle perspective, I should add, women tend to have more painful cycles, heavier cycles, and PMS, PMDD symptoms leading up to the menstrual cycle.
and if they're progesterone dominant, and so can you go through if somebody is more dominant in a hormone, testosterone, progesterone? I know I'm missing the other ones too, FSH, right?
Like thyroid, cortisol.
Yeah. If
Well,
you could
FSH and LH, they're the hormones that are released in the pituitary that stimulate our ovaries to
right. They're not like the hormones like estrogen or progesterone or testosterone.
No.
Right.
They're
Right.
simply they're the messengers that tell the ovaries, to prepare for ovulation and to release estrogen, produce estrogen and progesterone, and a little bit of testosterone. I have yet to meet a woman who is progesterone dominant.
Okay.
Is
that a thing, or did I just create?
Unless there's some sort of tumor that
Okay.
that leads to excess progesterone secretion. But and I'm not saying like breast cancer, for example. That's not what I'm talking about. And by the way, anything cancer related, I highly recommend the work of Dr. Jen Simmons. She is a breast oncologist, and she's done tons of research in this field where basically we know that hormones don't cause cancer.
Thank you for saying that, because that is a big, big myth out there that's why so many women are afraid to go on hormone replacement therapy too. I know there are some kind of cancers that won't allow it. It's
Mhm.
not good for them, right?
Well, you
Uh,
want to get through, you want to make sure that you're cancer free.
right.
And if you're at least few years cancer free, we have to go through that process. Once you're cancer positive, once the tumor is there, you have to do whatever it takes to get rid of that.
Right.
And then, we can start from scratch. But there's tons of research, don't take my word for it, tons of research in PubMed available, that shows that actually, hormones don't cause cancer, estrogen, progesterone don't cause cancer. I can talk about this a little bit more. Progestin, actually, synthetic
Mm-hmm.
form of progesterone. So progestin actually leads to increased risk of cancer, breast cancer in women, not even synthetic estrogen, which is huge because we used to be like, estrogen is the bully. It's, the source of all evil, but it's actually progestin, again, synthetic form of progesterone that increases the likelihood of cancer. But there's so many other variables. People don't want to talk about the diet. They don't want to talk about the environmental toxins. They don't want to talk about weight loss,
Exercise,
obesity.
weight management. No, they don't
Like,
want to talk about any of that. I want to get into that really deeply too, because both of us have that background as well.
yeah.
Okay, so progesterone dominant, you've
So
never seen it, but testosterone dominant, is that a thing?
some women can produce higher levels of testosterone,
Mm-hmm.
but I have not seen it be so high going back to like even progesterone,
Okay.
right? So I'll give you an example. A lot of women will get put on spironolactone if they
Mm-hmm.
have acne, hair loss, and their testosterone is, let's say, 40.
Out
So
of what's the healthy range?
so if we look, and all labs are slightly different, but let's say an average range for a woman is 5 to 50
Okay.
or 5 to 45. And sometimes women will produce really healthy levels of testosterone. They'll be slightly on the higher end. Let's say 40,
Mhm.
45 of the average range for testosterone. So a doctor will say, well, your testosterone is a little bit on the higher end. Let's just put you on a little bit of spironolactone, and that will clear up your acne and prevent the hair loss. So this is really common with women with PCOS. They're
Right.
constantly getting blamed for their high testosterone levels. And I come in and say, you have healthy testosterone levels. Your acne and your hair loss is not due to high testosterone levels. It is due to this imbalance between estrogen and progesterone, but
I
nobody's looking at that.
That's so huge. That's so
Yes.
huge. Can you
Yes.
say that one more time? Because that's huge.
High testosterone or high normal testosterone is not the cause for the PCOS symptoms. It is due to an imbalance between estrogen and progesterone. So we're putting women on spironolactone, dropping their testosterone. And testosterone is so important for women. So then we have women, their libido drops, their motivation drops. We have an increase in anxiety as well, because testosterone is so important. Testosterone is so important for muscle mass, also for bone health.
Right.
So we're taking women with optimal testosterone levels, great testosterone levels, and suppressing them. And we're just failing to look at that dance between estrogen and progesterone. PCOS is a lot more complicated than just looking at hormones, because a lot of times it's actually due to insulin resistance as well,
Mhm.
and potentially inflammation, gut health, all of those things. And I see a lot of times women will be doing all the right things. They'll be eating well, exercising. My goodness, I see women working so hard who have PCOS, and they cannot get their insulin under control, their blood sugar under control. And as much people hate talking about semaglutide and tirzepatide nowadays, I have to come in and say, for some women, it's been life changing.
I agree with you. And I'm really glad that you said that, because I've heard, and I don't know if you've heard, I'm sure you have, Jillian Michaels screaming about how bad it is for everybody.
Yeah.
For some people, it's saving their lives. And
Yeah.
that's important. Of course, with
Yeah.
anything, it shouldn't be abused, right? And that's what we
Absolutely.
saw last summer. Was it was
Yeah.
like everybody was on it.
Yeah.
It was like the Atkins diet, but not really. But I don't know. I don't know
Well,
what to compare it to, but it was
every
a thing.
yeah, absolutely. Every medication, every herb, every vitamin has the potential to be misused. I mean, I see
Right.
people doing crazy things on social media, taking copious amount of random supplements and preaching about the benefits of that. And some people think that that's okay, but every substance has certain level of either toxicity or negative consequence in the body. And semaglutide and tirzepatide, or Mounjaro, estrozapatide is known. These medications have done for people what they have not been able to do for years for themselves. And this is again, when prescribed properly, when we don't skip the steps of, did we get a complete nutrient profile, hormone profile, metabolic profile? Do we have their body composition baseline? What's their muscle mass percentage? What's their fat percentage? What's their resting metabolic rate? How does that change as we put them on this? I've had women who started on semaglutide, and as they've lost the weight, as they've lost the toxins that come along with losing
The
excess
weight
fat,
loss, right?
we've had to reduce their thyroid medication. They're no longer on the estrogen patch. And this is perimenopausal women.
Mm-hmm.
We've had to cut back on the progesterone because they don't need it as much.
Right.
Because now they've become so much more metabolically in tune, sensitive. They've become more metabolically efficient. And we get rid of the toxic weight. Now our receptors are free to receive the hormones, those chemical messengers. It just really can be life-changing for women. And I certainly don't want to turn this into a semaglutide talk. But going back to PCOS, how it's so much more complicated than, well, your testosterone is high. Let's put you on some spironolactone.
So if somebody, what would be, and then we'll move on to, I want to also talk about if your progesterone levels, well, are low, and same thing with testosterone, but um, how would a woman know that maybe she has PCOS? What
Yeah,
types of symptoms would she be going through right now?
yeah, absolutely. So a lot of younger women will, I say younger women because frequently this is a diagnosis that's sort of given to women at a younger age.
20s or teenagers?
As early as teenagers,
Okay.
at teenage years. Yeah. So it can be a painful menstrual cycle, um, facial hair thinning, acne. Those are some of the biggest symptoms. So you don't have to have actually ovarian cysts. It's sort of, it's a little bit deceived. The name is deceiving because technically you could have cysts
Mm-hmm.
as long as you have 2 or 3 of the main symptoms that are hallmarks of PCOS, you're sort of given this diagnosis. But those are the main symptoms. So if a woman, generally women who have facial hair or acne or hair thinning and or irregular menstrual cycle are sort of put into this category of PCOS.
You see weight gain with that as well?
Absolutely. Yes.
Okay. Okay.
Yeah.
Because I'm
Yeah.
just thinking about some women that I've known in the past.
Yeah. But you could also be a thin PCOS. I was one of them,
Right.
sort of the skinny fat person. She's like, how can you have you have PCOS, but you're skinny. It's like, yes,
Yeah.
skinny people can have PCOS too.
Right. Right.
Skinny does not translate into healthy.
I'm so glad you said that too. Skinny is not the word we're striving for
No,
ever.
well, and speaking of skinny, right? Like a lot of people will make even comments about, I'll post like workout videos online or something like that. And I am at 39, the healthiest that I have ever been. I am healthier, happier than I was when I was a teenager, than when I was in my 20s. I do not want to go back in my 20s. I am so much happier at 39. I'm stronger, I'm more confident, I'm more focused. I feel like I'm at the top of the world compared to
Wait
what I was.
till wait till you get into your 40s. You're going to love it even more. I loved my late 30s and all through my 40s. In my 50s, it got messy, and now I love being in my 60s.
Yeah, yeah. I love hearing that because so many times I mean, when I was a teenager, people told me wait till you're in your 20s. When I was in my 20s, people were like wait until you're in your 30s. Now that I'm in my late
I'm
30s,
sorry. I don't mean to
but
sound like that.
no, but you are coming in from a positive perspective.
Yes.
You're like, you're being positive about it. A lot of people are like, you'll wake up and like your back hurts. And I'm like, that's not normal.
No, that's
Your
not going to
back,
happen.
that's
As
not going to happen. I'm going to be proactive about it. But what I was going to say is that, you know, being skinny and being fit are two different things. And
that's right.
I am honestly at a lower, but at a healthy body fat percentage than I was in my 20s, even when I was a competitive athlete. And I had more issues then than I have issues now. So it's really important to do a DEXA scan to see how metabolically fit are you, and how are the things that you're doing to change your metabolic fitness, to reduce your visceral fat percentage, to increase your skeletal muscle mass. And how does, as those things change, how do you end up, how do you feel, right? In your, how do you feel?
Where could somebody get that type of scan?
Oh yeah, well, that's so easy to do. You don't need a doctor's order. You can just do this on your own. I like DEXA Fit. They have lots of different national locations.
Okay.
I believe Body Spec also has multiple locations across the United States. So DEXA Fit and Body Spec.
Okay.
You can also see who does DEXA body composition analysis in the area.
Yeah, I haven't had mine done in a long time. And
Yeah,
I'm just curious because obviously I don't, as a 63-year-old, I don't want to be losing muscle, but I'm still
absolutely.
lifting,
Yeah,
and because bone density, bone health, blah, blah, blah,
yeah,
we know all about that,
yeah,
which is why it's important to have a healthy diet and exercise. And I do want to get there. We will get there, but I just wanted to touch on testosterone also. If
yeah,
you have low testosterone levels, what would be the symptoms you would be
yeah,
going through right now?
yeah. And just to say something really important, because we started talking about sort of estrogen dominance and progesterone, sort of the dominance in terms of hormones.
Right.
It's really the only thing that a perimenopausal, postmenopausal woman has to be concerned about really is being estrogen dominant, because all other hormones are going to be in the tanker. And even if estrogen is low,
I love the way you said that. Yes, and she's right. It's all going to be in the tanker. Trust me. Yes, it is.
so you really don't have to worry about being dominant, except, you know, estrogen dominant, because everything is going to be on the decline. And even if estrogen is on the lower end, again, going back to the proportion, to that ratio,
Mhm.
you know, if estrogen is on the lower ends and it's not completely low, you know, how high is it in proportion to progesterone, or how low is progesterone in proportion to estrogen? So we don't really have to worry too much about dominance of any hormone besides
Okay.
trial and in the different phases of a woman's life. But um, with testosterone, low testosterone, women will have low libido, low motivation. It'll be harder to put on lean muscle mass. Testosterone is really important for that. Those are some of the most important signs and symptoms of low testosterone, but also really, really important because for women, we actually proportionally have more testosterone in our bloodstream in terms of concentration than estradiol. It really gives us that superpower.
It does.
And so for a woman not to be motivated, that's a really dangerous thing.
It is.
But it also affects our mood. It
Mhm.
also affects our anxiety and depression. Actually, very, very similarly to men. When men have low testosterone, they're depressed, they're anxious. And
They're
as soon as it
unmotivated.
reverse that,
Mhm.
you know, it's a night and day difference. And so, you know, unfortunately, again, this is very archaic and very old school, but, you know, men have a higher likelihood of getting their testosterone back on track, unlike women, because it's not seen as one of, it's not seen as important as some of the other hormones in women's health. And slowly, you know, with conversations like this and between different healthcare providers, that conversation is changing, right? we're talking about this
we
more
got to
and
keep
more.
talking about it.
Yeah,
We have to normalize these conversations. And
yeah,
I love the fact that women are talking about menopause. And I also love the fact that you say we're in menopause for one day. We go from peri, which could be 5, 10 years,
or
menopause,
longer.
and then your post, right? Or longer, and then
Yeah.
post. Because when I think about it, I was perimenopausal from 38, and then they put me on, I was on birth control. So it was I don't know, it was something with estrogen. I don't remember what it was called.
Maybe
And then what was that?
norethindrone. That's one of the
I can't remember.
estrogen.
This was back in, like I said, 2000, 1999.
And it was estrogen birth control.
Yeah, it was a low dose of whatever it was.
Mm.
But it was so, and that also helped with my hot flashes. That's all the help that I got. But
Mm.
then my periods went back to regular periods up until I was about 45. And then it started, I started getting all
Yeah,
of those symptoms. So for the ladies listening right now, if you are having infrequent periods or things are fluctuating, please see a hormone specialist.
yeah,
Get in touch with Dr. Elena here, please. DM her and talk to her. You can do these things virtually, right?
absolutely. And I
Right.
have to say that, some people may not be able to work with me, but even if you go onto the Institute for Functional Medicine website, you can search for providers in your area or healthcare providers who are working remotely and can do telemedicine. If you go to your primary care physician, let's say you're listening to this and you're so confident, you're like, I'm going to go with this list of questions to my healthcare provider, who's my primary care physician, or maybe your OBGYN, the likelihood of you getting shut down is pretty high because unfortunately it's still not as mainstream. Doesn't mean you can't try, but
Sure.
I've had girlfriends who I said, you can start with your primary care physician, but like I'm just, getting you ready. We'll do a pep talk. Like it's not going to go as you like, as you want. So, we have to have these other doctors lined up for you who
Yeah.
specialize in hormone
Yeah.
therapy replacement, or at least do some sort of functional medicine. At least be open-minded. The healthcare providers need to be open-minded and knowledgeable on how to prescribe hormone replacement for women. And I've had so many girlfriends and friends and people who DM me on social media say, oh my gosh, I had such a horrible experience with my primary care physician. I had such a horrible experience with my endocrinologist, with my OBGYN.
Right.
And I've heard this so many times that I have to say, find a new healthcare provider. You have to just find a new healthcare provider. We do this in all other aspects of our life. Like if we go on a date, we don't like someone. Do we need to see that person? No, we don't. Right. If we hire, it's tax season. So if we don't like our CPA, do we need to stick with them if they end up causing trouble? No, we don't. We can hire a new CPA, right? It's more expensive to keep the CPA that's making tons of mistakes. And it's more expensive to not take care of our health problems in the long run, right? Than it is to address them head on nowadays. But if you're pumped about testing your hormone levels, getting your baseline, please note that your physician may not be as pumped as you are, but it doesn't mean, that other physicians are not out there to help you. It's just, you have to, besides getting like a hormone baseline, you have to find that healthcare provider that's going to be there with you through the different stages of life and not normalize achy joints, brain fog, all the other symptoms like memory loss, digestive issues, low libido, menstrual cycle regulations. Those happen as they can start to happen as we age, the symptoms.
Sure.
But we have the technology and access to medicine and medications and hormone replacement to not have to live with those symptoms and to actually improve the function of our cells and of the major organs in the body.
So how early can a woman start with hormone replacement therapy? And can you explain the difference between bioidentical hormones and synthetic hormones and what you work with?
Yes, absolutely. So we never work, quick answer, we never work with synthetic hormones. We only work
Okay.
with with bioidentical.
Right. I knew you were going to say that, but because people I think are so used to thinking that, oh, I don't want to put that in my body. It comes from a pig, it comes from an animal, and don't understand that bioidentical hormones are plant-based. And I'll let you explain it.
Yeah. So we don't want to use synthetic hormones because synthetic hormones, they really don't work the same way as bioidentical hormones. When we put synthetic hormones in our body, that increases our risk of blood clots, cardiovascular disease, stroke, cancer. They're pro-inflammatory. Bioidentical hormones don't do that. They reduce the risk of cardiovascular disease, reduce the risk of cancer, reduce the risk of developing diabetes and other metabolic diseases. So they're, they're two separate classes of medications and don't function in the same way. So when I prescribe hormones, I only prescribe bioidentical hormones. Bioidentical hormones meaning they mimic in chemical structure the same hormones that your body produces innately. And yes, they're formulated in a lab. However, in order to make this mass production and be able to have access to a specific concentration of that hormone for delivery, we have to have access to them, right? In that way. Yes, they will be made in a lab, but they mimic your own natural hormone production. And what's interesting is that I was doing a talk. I was doing a presentation at a women's health talk, and someone asked a really fair question, which was, well, how did our ancestors live without hormone replacement? Because this goes back to a lot of women just want to be able to age naturally without any support.
I hear that all the time.
And I'm like, well, how did it work out for our ancestors? Because in the 1920s, women were lucky to go through menopause and into postmenopause because
Right. Because they didn't even live that long.
No, the average age for a woman in the 1920s was around 54 years.
Right.
That's the average life expectancy. So if we think about women going into postmenopause between the age of 45 to 55, we are lucky to live that long nowadays. However, the average life expectancy now is about a quarter of a decade more. So women are now, average life expectancy is about 78 years old, 78 years. So we're living longer, but if we don't take the advantage of the medical advancements and access to hormone replacement, we're suffering.
Well, that's where the closed-mindedness comes. And this is why we're doing this show. And we'll probably do it again to open up the minds, because every time I have you on the show, we learn more and more and more. So what is it too early to ever start with hormone replacement therapy?
So thank you so much for going back to the beginning of this question, because I think this is so important for women to hear.
We have 4 minutes left.
It's not too early. That's okay. I'll come back.
Good.
It's not too early to start on hormone replacements when you're a teenager or you're in your 20s, if your body needs it and you're not producing this on your own, such as with hypogonadism. If your body is not producing these hormones on your own, of course, we have to rule out, is it nutrient deficiencies? Is it physical trauma to the glands, to the organs? Like, we have to understand first, what is the culprit? Why is someone not producing these hormones? But if we check mark everything and try to get the body to produce hormones on its own, and it's not, there shouldn't be anything in the way of us starting hormone replacement early on. So I have women as early as in their 20s starting hormone replacement. I wish I started hormone replacement when I was in my 20s.
I wish I started it in my 30s. I wish as soon as, I get it.
And the two hormones that I start earlier in perimenopause are progesterone and testosterone. We didn't talk about the other hormones that tend to decline with age, and that is thyroid, DHEA, and growth hormone. So those are really important hormones to consider for any perimenopausal woman. But even if someone is in their 20s and they're struggling with symptoms of fatigue and acne and brain fog, it's really important to test all of those hormones and not just estrogen and progesterone.
I'm glad you said that. That's why you definitely have to come back. Okay. And I said we were going to talk about it 20 minutes ago, but in like a minute, can you please explain why it is important to exercise and maintain a healthy diet?
Yeah, absolutely. Your muscle mass is your metabolic currency. And so your muscle mass doesn't just serve a protective function as you get older, but it prevents metabolic resistance, insulin resistance. It supports bone health. Your muscle mass is also directly linked to brain health and brain-derived growth factors. So whenever you lift, whenever you flex and extend in the gym, you're actually supporting brain health. And as much as our diet is sort of flawed nowadays, we can still make better choices, but it all comes down to what we put in our body and how frequently we move. We have to focus on eating more anti-inflammatory foods, moving away from inflammatory seed oils, processed grains, sugar, excess caffeine and alcohol intake. All of that has to go. So all those things can be pro-inflammatory. So when it comes to our diet, we want to shift to healthy fats, lean proteins, and endurance-based workouts, including weightlifting.
There you go. And I've been doing that for 43 years and you've been doing it your whole life too. So
and this is why you look so fabulous.
This is reverse aging. It starts with moving your body and making sure that your hormones are balanced. That's it in like 30 seconds. Where can our listeners find you?
drelenazinkov.com, and I'm predominantly on Instagram at drelenazinkov. And then my clinic website is proactivehealthnd.com.
Dr. Elena, thank you so much for joining us on Fearlessly Authentic. And everybody who's listening, remember to rate, review, and subscribe. And until next week, stay fearlessly authentic. Bye-bye, everyone.